Hello, and thanks for joining us today. I would like to give you some important information on working with justice involve young people who identify as lesbian, gay, bisexual, transgender, questioning, queer, or two-spirit. The plus in this acronym is there to acknowledge the many sexual orientations and gender identities that are not explicitly represented. Sometimes, researchers and programs will not include two-spirit in their acronyms as there is generally less research, data, and programmatic support for and about two-spirit people. The term two-spirit has historically been used by Native American two-spirit people who are male, female, and sometimes intersex individuals who combine activities of both men and women with traits unique to their status as two-spirit people. In most tribes, they were considered neither men nor women. They occupied a distinct, alternative gender status. Young people who identify as LGBTQ2S+ navigate a host of complex and harmful circumstances, such as social stigma, discrimination, family rejection, and bullying. Lack of support in crucial spaces can lead to negative mental health and quality of life outcomes. For example, LGBTQ2S+ youth that experience high levels of rejection are 8 times more likely to report attempted suicide, 6 times more likely to report symptoms of depression, and 3 times more likely to use harmful substances than LGBTQ2S+ youth that are in highly supportive environments. This is due to the additional stress and hardship the population experiences as a result of discrimination and a lack of support. For instance, if a family rejects a youth's identity, they may run away from home or be kicked out. In fact, several studies show that around 40% of young people experiencing homelessness identify as LGBTQ2S+. Further, some LGBTQ2S+ young people may be bullied in schools so severely that they stop going to school or get into fights at school. Without appropriate supports, a young person may become dependent on unhealthy coping mechanisms like substance use. Circumstances of homelessness, truancy, or fights in school and harmful substance use are all examples of ways that LGBTQ2S+ young people might find themselves involved in the child welfare or criminal justice system. As a result, over 30% of the young people involved in the child welfare system identify as sexual and gender minorities, and they are more likely than straight and cisgender youth in the child welfare system to cross over into the juvenile justice system. In the juvenile justice system, as many as 20% of youth identify as LGBTQ2S+. LGBTQ2S+ youth are overrepresented at every stage of the juvenile justice system: arrest, incarceration, and community supervision. For example, 40% of girls in the juvenile justice systems identify as lesbian, bisexual, or queer, and/or gender variant, and data show that lesbian and bisexual girls are 4 times as likely to be arrested compared to those who identify as straight. Within the LGBTQ+ community, higher rates of overrepresentation are found among people who are transgender and queer women. While in the juvenile justice system, LGBTQ2S+ youth are particularly vulnerable to harmful treatment, harassment, and physical and sexual violence. In 2010, the Bureau of Justice Statistics, BJS, surveyed more than 9,000 youth in 195 juvenile confinement facilities across the nation to determine the prevalence of sexual victimization of residents. Along with a disturbingly high incidence of sexual assault overall, the survey results revealed that youth who identified as lesbian, gay, bisexual, or other reported significantly higher rates of sexual victimization by other youth, 12.5%, compared with straight youth, 1.3%, nearly 10 times higher. Despite the hardship this population has endured, as a result of relentless discrimination, it is also a population of incredible resilience. Data show that when LGBTQ2S+ young people are supported and affirmed, their mental health and quality of life outcomes greatly improve. We know that LGBTQ2S+ youth who report having at least one accepting adult in their lives are 40% less likely to report a suicide attempt, and when LGBTQ2S+ young people are in environments where they are always affirmed, over 90% of them believe they can grow up to be a happy adult. The belief that they can grow up to be happy adults is imperative to their resilience and overall health. How can JJ Systems support LGBTQ2S+ youth? Prohibit discrimination on the basis of gender identity, sexual orientation, sex assigned at birth, or gender expression. Ensure that this is explicit in the agency's policy and that there are protocols for the affirming care of the LGBTQ2S+ youth. Ensure bias related to the youth's sexual orientation, gender identity, or gender expression was not the underlying or basic basis for arrest and court referral. Train everyone who interacts with the population on what behaviors are helpful and which are harmful to LGBTQ2S+ populations, including what professional guidelines and federal mandates require. Research has shown that knowledge and attitudes towards LGBTQ+ people significantly influence the way juvenile justice staff treat the population. Ensure the climate communicates respect by messaging the non-discrimination protocol, displaying symbols of affirmation, and having a safe and confidential grievance policy. Collect information about sexual orientation, gender identity, and sex assigned at birth in safe and respectful ways. When asking questions about identity, ensure the young person has a private place to answer them. Staff should respect a youth's privacy right and never disclose a youth's sexual orientation or gender identity unless the youth has given permission to disclose their identity or status. This includes not disclosing information about a youth's LGBTQ2S+ status to anyone, including the youth's parents, without obtaining the youth's consent, unless disclosure is required by a court order or applicable statute. Provide tailored services that meet the underlying needs of LGBTQ2S+ youth. This could be LGBTQ2S+ affirming support groups or specialized programs for families. Families should be engaged in programming to learn how to support their LGBTQ2S+ youth. These types of programs and services can prevent entry or re-entry into the system. Ensure LGBTQ2S+ youth are assessed for their mental health and substance use needs and connected to culturally appropriate treatment services. When the source of a delinquency charge against a LGBTQ2S+ youth originates from an existing child welfare placement, or where safety issues exist at home or in the existing placement, require alternative placements be evaluated on their ability to provide a safe, supportive, and affirming home, including the youth's family of choice, and presented to the court. Juvenile justice and child welfare systems must incorporate processes to ask youth about their cultural needs, including tribal affiliation and membership, and actively connect them to culturally appropriate resources. Ensure equitable treatment and standard enforcement. Staff should not punish or prohibit behavior that is perceived to defy gender norms or withhold LGBTQ2S+ services as a form of punishment. Further, isolation policies to protect LGBTQ2S+ youth are not appropriate. Isolation is a form of punishment. The use of isolation to safeguard someone from harm is in itself extremely harmful. Make affirming and appropriate housing decisions. Staff should make classification and housing decisions on a case-by-case basis and must not automatically house youth solely on the basis of their actual or perceived LGBTQ2S+ status. Staff should not automatically house transgender or intersex youth according to their sex assigned at birth. They should determine the appropriate housing unit after consideration of the youth's health and safety, potential management or security problems, the youth's perception of which housing assignment will be safe, and any recommendations from the youth's healthcare provider. Because LGBTQ2S+ youth are at an increased risk of victimization, it is important that staff accommodate any youth, including transgender or intersex youth, whose physical or emotional condition justifies privacy while showering, performing bodily functions, or changing clothing. Agencies should also ensure that transgender youth have access to medically necessary gender-affirming health care, and that this health care be determined by someone who is qualified in this area of care. Treating LGBTQ2S+ young people with dignity and respect is about justice. Equal justice for everyone. But even more than that, as a juvenile justice professional, you can have a positive impact on LGBTQ+ young people you encounter. Your support to the young person or their family may be the positive experience that reduces their chance of recidivism and leads them to improved health and quality of life outcomes.